This video is made to introduce our research to develop a measurement system for the verification of beam range and dose distribution in particle beam therapy. Compared to conventional radiotherapy, the particle beam therapy using proton or carbon beam has many advantages. The particle beam has finite beam range in medium, and it delivers almost all of its energy at the end of the beam range. Using this characteristic, the dose of a particle beam can be highly concentrated on the treatment site. If we suppose to treat the site marked with box using the conventional radiotherapy technique involving LINAC X-rays, the high dose is delivered to the proximal side of the treatment volume, and there is also significant exit dose. However, if we use a particle beam, we can deliver highly conformal dose to the treatment volume, and there is negligible exit dose. Because of these advantages, the interest in particle therapy has been rapidly increased. After the introduction of medical dedicated accelerator in 1990s, the number of particle therapy centers and patients treated by particle therapy has been dramatically increased. However, these advantages in dose distribution can cause some problems. As you can see, if unexpected density variation occurs in the patient, in the particle therapy, the prescribed dose is not delivered to the treatment volume, or high dose can be delivered to the healthy tissues or organs. Due to the uncertainties in the particle beam range, the treatment margin is usually employed in particle therapy. Because this margin delivers unnecessary dose to normal tissues, the technique for real-time verification of the beam range in patient should be developed to fully utilize the advantages of particle therapy. The particle beam is totally absorbed in the patient, so the measurement of secondary radiation generated by proton and elastic interaction was proposed to determine the beam range. We proved that the particle beam range can be determined by the prompt gamma distribution measured by our measurement system. However, this system was just developed for the proof of the principle, and it cannot be used for clinical purpose. It is very large and heavy. For clinical use, we are developing an array type measurement. We designed the measurement system based on Monte Carlo simulation using MCNP and JANT4 codes. Because we can simulate the behavior of radiation by Monte Carlo simulation, we can accurately estimate the performance of the design system before actually building the system. We performed Monte Carlo simulation for performance estimation. With the Monte Carlo simulation, we confirmed that the beam range could be determined by the design system. Based on these results, we have constructed a real measurement system. Before we develop a full system with multiple detectors, first, we develop a small test system with a single detector. Using therapeutic proton beams, experiments were carried out, and it was confirmed that the beam range can be determined with our system. The results were published at Medical Physics Journal in 2012. Based on these results, we developed an array-type prompt gamma measurement system. The system consists of a multi-channel signal processing system using commercial preamplifier and amplifier chips. We tested the performance of developed system, and we found that the beam range can be determined within about 2 mm error. Based on developed system, we are currently developing a measurement system for head and neck cancer treatment. To apply the head and neck site, we designed the measurement system in a circular shape. To estimate the performance of the suggested system, we performed the Monte Carlo simulation. By simulation study, it was confirmed that the developed measurement system can determine the beam range with very high detection efficiency. To monitor the particle therapy, we are also developing a 2D measurement system. The goal of this study is to measure not only the beam range but also the 2D dose distribution in the patient. By Monte Carlo simulation study, we determined the design of the system and we constructed the 2D measurement system. The 2D measurement system consists of a parallel multi-hole collimator, a 2D scintillator array, a multi-anode photomultiplier, signal processing, and data acquisition system. We performed the experiment with a proton beam and confirmed that the developed system can determine 2D dose distribution and particle beam range. Recently, we suggested a new imaging method called gamma electron vertex imaging to determine proton beam range. To determine the generation position of prompt gammas, in JEVI, the gammas were converted to electron by Compton scattering in the electron converter, and then the converted electrons were tracked using two horoscopes. Using the trajectories of the electrons, the generation position of the prompt gammas were determined with a line back projection algorithm. To test the feasibility of new imaging method, first we performed some Monte Carlo simulation for therapeutic proton beams. And our simulation results show that the gamma vertex imaging can be used to image the proton beam dose distribution or to measure the proton beam range in the patient in proton therapy. For carbon beam either. Based on simulation study, we have constructed a prototype gamma vertex imaging system. To track the trajectories of the converted electrons, we used two DSSD as horoscope detectors. To process the signal from the DSSD detectors, we have developed a low-noise signal processing system. It converts the charge signal generated by detector to a voltage signal. As the performance test, it shows almost same performance with a commercial product. Next, we developed a shaping amplifier to amplify and shape the signal to Gaussian shape. Considering the characteristic of the used detector, we can develop a various kind of shaping amplifiers. Finally, this is multiplexing system developed by our lab for reducing the data acquisition channel. Using this system, we can reduce 16 channels to 2 channels. This is another detector in the JV system. This detector is used to determine the electron energy. This image shows the plastic scintillation detector developed together with Siliconics in Netherlands. We developed a DAQ and image reconstruction system. Using the digitizer, we converted detector signals to digital signals. With the data analysis program, we determined the effective events in energy and time window and reconstructed the 2D images using the line back projection algorithm. Please check the upper left side and you can see the developed system. Using the system, we performed experiments to measure the 2D images of radiation sources. The system shows a satisfactory performance and we are planning to do experiments with the proton beams very soon.